Dr. Karthik is a trained physician and hospital management expert with more than 10 years of administrative and clinical experience. He is a healthcare strategist and process improvement leader and has worked for one of the top 5 largest for-profit and non-profit health systems and renowned academic medical centers in the United States and Asia. He holds Masters in Health Administration from USC Price of School of Public Policy and Bachelor's in Medicine and Bachelor's in Surgery from Sri Ramchandra University. He underwent an executive training in strategic leadership from Harvard School of Public Health. He is a recipient of the Honorary Donald W. Reynolds FDH Fellowship Program in Geriatrics from the UCLA School of Medicine, leans 6 black belt from Villanova University, and Human-Centered Design Thinking training from IDEO. Dr. Karthik is a member of American Geriatric Society, Indian Academy of Geriatrics, Confederation of Indian Industry, Senior Care and Association of Senior Living India. He has published many impactful research papers in leading international journals based in United States, Europe and India. Now, I would like to welcome Dr. Karthik Narayan, Managing Director, Athulya Senior Care, onto the stage to deliver the welcome address and to talk about the insights of geriatric care in the industry.
Good evening, everyone. Firstly, welcome to our first annual Geriatric Care Conference. It's such a pleasure and honor having all of you. A very special welcome to all our physician friends. You are the stars of the night. Without you, we wouldn't be here. Very thankful for the service and passion you show in medicine. Especially the last 2 years has been challenging for all of us. So thanks for your continued service. Just to introduce myself, I'm Dr. Karthik. I'm part of the Athulya family. I'm a physician executive and healthcare administrator. With a lot of passion, we've started Athulya, and that's why we're here. As I go deeper into the presentation, I'll give you an overall view on how the industry is growing, what are some policy frameworks that are coming in, and more on the data points that might give you some insight on where things are going. The first slide is at a higher level of how the elder care or the senior population is going towards. WHO calls it the decade of healthy aging. There's another word called the silver wave. What we are seeing today is a young India that's getting aged, and we have to be prepared for it. Some of the data points I want to highlight on the right side of the slide, if you guys can see it. From 100 million, it's going to move towards a 320 million, and a 300% growth on the 60 plus population, and a 700% growth in the 80 plus population. Guys, this is pretty alarming, right? Our health system are not prepared for this. Today we are designed more for a typical hospital environment or a typical clinic environment. A system that to handle this kind of influx is yet to be prepared. Moving into the bottom image, where you can see Tamil Nadu being the second highest when it comes to the elder population. I want to take a few minutes and highlight in one of the largest studies that happened in the world when it comes to the aging, the longitudinal aging study in India. They call it the LASSI. It was published in the year 2020, and it was a large group sample size that was collected and looked into. More than 75,000 people were surveyed, and most of them being seniors, close to 31,000 elderly. And I'm a proud alumni of this network, and I'll be talking some of the key data points that were covered. Some of the highlights are put into this one slide. I'll just read it out, one or two key data points that might trigger some thinking in us. 1 in 2 elders are going to be suffering from loneliness. 20% of the elders need psychological counseling. 11% of the elders at least have one physical or a mental illness. 18%, almost close to 20% of the elders are most likely to live alone. That's again a huge issue for us when it comes to taking care of that population. 25% of the elders suffer from more than one chronic condition. 23% the prevalence of falls and injuries in higher in elders. And the insured population is a very, very small percentage that we're going to be seeing, even though it shows 20%, but the 20% is the RSBY, which is the National Health Insurance Program, and a very small percentage, only 7%, is the private. These are some of the deeper graphs I wanted to highlight. This is an important slide, guys. Why guys want to pay attention to this is, if you guys look at what's happening, or basically what the slide is telling us, the crude birth rate is coming down, and the crude death rate is coming down too. What that means is, less children, more elderly. I mean, less children are going to be born, and the elders are going to be living longer. Moving to the next slide, the chronic health conditions. It basically shows you on the concentration of disease conditions, especially the cardiovascular and lung disease, if you guys can look into it, where you can see it is highly concentrated in the elder population of age 70 and plus, followed by the other chronic conditions. The next slide is on the morbidities. I want to mainly stress on the multimorbidity, where you're able to see the red line, where you can see as age is progressing, it is higher. And very interestingly, once I started analyzing the multimorbidity of what population, it is mainly existent in the urban, affluent, and educated audience. So that's something we need to look into. Just because we all provide care in developed cities doesn't mean that our hospital systems are going to be hitting more healthy elderly. It is going to be a lot of elderly with many clinical issues. I want to spend the next few minutes talking on what are the models available in the geriatric care across the world, and some of which are available in India, and we are looking into some of it as well. So to start with, at a very broad level, there are two systems that are available. One is a long-term care, which is the institutional-based approach. The other is the home-based approach. When it comes to the institutional care, there's independent living, is nothing but your retirement homes, which are real estate players. Assisted living, which is facilities that handle elders for their day-to-day activities, supporting them. Continuum care and retirement homes. Continuum care is basically facilities with rehabilitation. Skilled nursing, it is a long-term subacute care in developed countries, that's how they would call it, but it's mostly your post-hospital and your ICU care, but in a outside hospital environment. Lastly, hospice care, which is your end-of-life care, which is helping elders who are in the terminal ill conditions. I'm sure Dr. Satya will touch deeper about it. Moving on to the home-based care. Subacute care. Subacute care is where the home health players are mostly handling clinical issues. Supportive care, these are home health players who are handling more emotional, nutritional kind of issues. Community-based care, it is basically where volunteers and other subgroups are involved as a family sometime to take care of the elders. Moving into the specialized care, there are senior day cares, where it is a day program where rehabilitation is done or mental health counseling is done, where they come in for the day and they're out by the evening. Mental health and memory care programs. So this is just a high level for you guys to have a view on the whole how geriatric healthcare system is evolving. And as you guys start going in deeper and deeper, you'll see how much of it is available. It's only a question of awareness that needs to be built. I want to kind of spend the next few minutes kind of highlighting what's available out there and how we are kind of positioned. So what's available out there is retirement homes, which are mostly run by real estate firms, where their primary goal is to sell the asset and with a very minimal clinical involvement. The other end of the spectrum is the home health players, which are most likely staffing agencies, which are helping if you need a doctor or nurse for different age groups. But what we do is a little bit more deeper clinically. In a very simple language, if I have to put it, a retirement home may have 2-3 nurses, but assisted living or a skilled nursing facility in Athulya will have close to 200 nurses. Likewise, in our home health program, we have a care program and a care plan, whereas some of the other home care would be more staffing based, but we go a little bit more deeper to understand the clinical condition, and we give a care plan, and we do have a care program manager run by a nurse. So not just us, there are many other players who are getting into this space. The industry is evolving as we speak. It's going to get more and more clinical, more and more complex, and more organized as we speak. The next few minutes I also want to spend on what are some of the policies that are available out there. Policies for a country is the foundation, right? That is where it gets started. 35 years back, if you looked at it, were there corporate hospitals? Not really. So today, elder care was looked into at least 5-7 years back as a non-profit initiatives, but today an enterprise level work is happening. It's time for us to start looking into how we can start integrating. So there are two large policy initiatives. One is the NPHCE, which is the national body looking at initiatives to look into senior care industry. They work very closely with the Ministry of Health and Social Welfare. The other is the National Action Plan for Senior Citizens, which is a pet project of our Prime Minister. It comes straight from the PMO's office to look into what are the initiatives we can be taking continuously at all departments on creating an environment for our seniors. These are some quick highlights of what these policies are covering. This is the NPHCE. The first is the regional institutes. Dr. Shanti is here. I'm sure she is spearheading one of the largest geriatric care centers that's coming up in Tamil Nadu, where our other centers are coming up as we speak. The second is the community health centers integration. There are going to be OPD clinics coming up with specific to geriatrics, because unless you go into the deep grassroots level integration, it's not going to get communicated. Some of the fourth highlights is workforce capacity planning. That being a very important piece today, because unless there are physicians trained in geriatrics, unless there are skilled workers coming at a very, very frontline level, we won't be able to handle the system. For this year alone, from the budget, they've allocated close to 60,000 workers in the skilled workforce just on the geriatrics. Lastly, promoting healthy living and active aging. Moving to the next policy highlight is the action plan. The action plan basically under the Prime Minister's office covers basically every department, right from financial security, healthcare, protection of life and property, active aging, accessibility and transportation. We will be seeing this in Chennai very soon, guys. You guys keep an eye out for this. The Chennai 2.0 smart city development is going to be integrated with geriatric friendly cities. That means right from the buses to your parks are going to be senior friendly. You will see coming it very soon. Awareness generation and capacity building and promoting the silver economy. This is one of our favorite topics, publications and presentations. We're very proud to present several high impact papers across India and international. I invite all our physician friends to be involved in any of the publication work you guys want to do in the geriatric sector. So some of the papers that we have done is with AIMS, with the American Geriatric Society, with CMC Vellore, with Mahatma Gandhi College Pondicherry, and with the European Association of Palliative Care. I want to end my slide because there are prominent eminent speakers coming up, but this is something I want you guys to kind of immerse yourself and prepare yourself for the presentation, to look into very differently how elders have to be handled as the silver wave is going to hit us. I'm just going to read this note from Anjali Sharma, who is a PhD scholar from the Institute of Social and Economic Change. Here it goes. Life expectancy has shown considerable improvement, but if these added years are dominated by declines in physical and mental capabilities, the implications for the older population and the society will be much, much more negative. Hence, an integrated approach to align the needs of the elderly as well as older elders in programs and policy is the need of the hour. Right? Unless health systems across, right from clinics to hospice and palliative care, work end to end, we won't be able to take care of our seniors. Either it's in our own house, in our own clinics, or the community. So it's time for us all to start working together and welcome a very happy and a healthy, safe aging. That's it from me, guys. Thank you very much.